Okay. Okay, so we were here, next open question. So this is, can you please tell me more,
Man,
could you,
enggak. Oh,
excuse me, could you please mute your mic? Thank you. Okay, so next open question would be, can you please tell me more about your vomiting, more about your sore throat, more about your headache? For example, a patient came with headache, then she will say, oh, it's been started 2 days ago. Sorry, you need to aid the people. Okay, so you will empathy again. You have to say, I'm sorry to hear that. Let me summarize what you have said. You have said that your pain is starting 2 days ago. It's getting worsening. It's on the left side of your head, and you also have tearing eyes, etc. So you have to summarize what she has said, and then you say, "Is that correct? Am I right?" And she say, "Yes, I'm right. Yes, you're right." And then you will go for the explore the present complaining. So when you for that you need to follow a special approach which we call, if the patient with the pain, you need to follow Socrates. If the patient with the pain lays, then you have to follow Oedipara. A patient with any even full syncope, this is all everywhere the same. So you have to follow the new approach. So this is different way. Then you go to explore the present in complaint. When did it start? For example, did you have similar episode before like that? Then you have to, is it continuous or on and off? She said it's continuous or on and off. It's up to, it depends on the patient. And then you ask, is there anything make it worse? Is there anything make it better? How would you rate your pain on a pain scale from 1 to 10 being worse? She said 9, 8. So this is what you are going to explore the presenting complaint, okay? Then you have to go to follow the systemic review as we usually do, but in our language. So here you need to follow this one. For example, patient came up with vomiting or any GI problem. Do you feel sick? Yes or no? Did you throw up? Yeah. She said yes. Was there any blood or what color was that? She can any tummy pain or discoloration. So we will discuss in when we start this history on uh, in next slides, okay? Urogenital, you need to ask her any changes in your urine. If she say yes, then you need to ask her any blood, any urethral discharge, or anything relevant to urogenital. But if she is asking about, for example, she just came off urethral discharge, then you also ask upside down question for any changes in your urine or anything else. Then you go for dermatology, any rash or skin changes. Miscellaneous, you need to ask about temperature, night sweat, any lump or bump in your body. So what you have to do basically, first you need to ask 2 questions relevant to the complaint of the patient. For example, if patient came up headache, how will you start? Will you start from GIT or you will start from the nervous system? Can you please tell me, guys? How will you start if patient came with the headache? Which
nervous
system?
system.
Nervous
Nervous
system.
system. Yes, you will start with the nervous system, then you will go for musculoskeletal, then you will go for the dermatology or miscellaneous, and then you go for further GI or urogenital. So you need to prioritize the systems. If patient came with the tummy pain, you need to go for GI first. If patient came up with the headache, you need to go for the CNS. So this is how, if patient came up with the chest pain, you need to go for cardiovascular. Shorter breath, you need to start with the respiratory system. Okay, so you need to prioritize according to the patient complaints. Okay, after that, you need to go for the past medical history. You need to ask the patient about any past medical disease in any previous surgery. You need to ask her, and this is a very, very easy, and you just go ahead. Drug and allergy, any prescribed medication, you need to ask her. Any allergy, you need to ask her if she has it. Family history, any disease run in your family. Maybe patient say diabetes, if he has diabetes, or you're suspecting a patient maybe has any other problem, so he will say, or like asthma or any other disease. Social history, you need to ask her, where do you live, whom do you live with, what do you do, means like profession as well, smoking, or these all everything you need to ask. Sexual and travel history, this is you need to ask only in a specific station. For example, patient with the dysuria or ureter discharge, then you need to take the sexual history. But there are a lot of questions in sexual history that we will discuss when we'll come up with the sexual history stations. Okay. Next is traveling history. You need to, if the scenario is given, the traveling patient who came back from any country, for example, from the sub-Saharan continent, or for example, patient came from the Nigeria, or where the disease prevalence is very common, or from Malaysia or any other places. So you need to take the travel history as well. But you can get in the scenario as well this about that. Open question next would be, would you like to add anything to better understand your condition? This you give her chance. If you miss anything, or maybe if the actor is cooperative, maybe she can tell you, yeah, for example, you miss something and maybe she can tell you, yeah, I have the disease, this disease run in my family. Like she can tell you, oh, my dad has asthma. Maybe you forget to ask her the family history. So if the actor is cooperative, she can give you idea. Okay. Or she want to add something, she will add something here. Okay. The next is ICE. Here you can idea, concern, or expectation. So what's your concern? Or you can, what do you expect from us? Like this kind of things. Okay. You need to ask the patient. Okay. After that, you need to go for diagnosis and differential. The big problem is that sometimes the R can give you the station. I will show you in next slide. Okay, I just move it to next quickly here. I just skip it here a little bit to show you this one. Okay, just see this scenario. Okay, here the task will be mentioned. You will have exact like this scenario in the case, and you will have the task like that. They will specify your task. Take a history from him and then explain management plan to him. Now, in this task, you have two things to do. You need to information gathering, means you need to take the history, and you need to go for management plan, which we call the clinical reasoning. Sometimes they mention management plan, sometimes they mention clinical reasoning, information gathering. They also sometimes mention information gathering, sometimes they mention tech history. So whatever you got, you need to understand this chart. This is a pie chart. If you understand, you're done with the exam. If you do not understand it, you will lose your score. For example, here they ask you two things. You need to go history and you just need to go for the management plan. But if they give you another chart, for example, 20% here, they ask you to explain the differential diagnosis, and you took the history and you go for management plan, but you didn't explain the differential diagnosis. For example, you didn't talk about, you said, okay, for example, yeah, the acute pancreatitis, you should know the differential. If you know the differential, you need to tell her. Okay. The peptic ulcer disease, yeah, you need to tell her, yeah, it can be the cause, the medication you're taking, like NSAID, or could be H. pylori, could be another. So you need to tell her the differential. If you do not tell the differential, if they ask you, if they put the 20% for differential, you will lose 20%. You will get the rest of the score, but lose 20%. So in history taking, you will have different kind of pie chart. If they ask you to tell the differential, you have to tell. Don't need to just go for tech history and go for clinical reasoning, management, or finish. No, you will get the score, but not 100%. So you need to be very, very careful. So let's back to the history taking. Okay. So we were here, diagnosis and differential. So what you have to say, you have to follow. You can say according to data, or you can say according to your information, or according to the data which I have collected from you, the most likely the problem is this. However, I need to I need to rule out other diagnosis or other disease, other problem of your health. For example, peptic ulcer disease, if she has tummy pain or anything. So you need to explain, I need to rule out these diagnoses. So what I'm going to do now, I will keep you here. And if the patient reaches, you need to keep a research. If not, then you can say, I will keep you here in the hospital. If you think the patient requires admission, you need to say, I will admit you here in this hospital, and then I will, sorry, the people are, yeah. I will admit you here and I will do the examination of your tummy, and I will also order some investigation, which will include full blood test, or you can say I will do some blood test. Make it more simple. Blood test, which will include full blood count, blood culture, and apart from that, I will do your tummy scan to check it what exactly the problem. If I found that you have blah blah, I will involve the medical team for your management plan. Okay, so this way you can explain her. Okay, so this is about the differential. You will tell some part from differential and some part from the management plan. So we have to follow 3 steps in management plan. Either you need to, if the patient need admission, you need to go for admission. Then you need to go for examination. Here you can also go for like, I'm going to keep you in observation. Okay, you can say like that. Then you need to go examination. I will do the exam. I will examine your tummy. Okay, you need to verbalize. And then you need to go, I will do some blood tests, which will include full blood count, your the pregnancy test or urine dipstick for pregnancy if the patient is relevant to that, according to complaint and infection. I will do camera scan, for example, you are going for the endoscopy, so you need to say camera scan. Or if you want to go for the CT or MRI, you need to mention that. After that, you need to go for, sorry, could you please close camera? Okay. The next is, okay, after that, you need to go ask the patient to confirm, is it clear so far? Have you understand what I had explained to you? Patient will say, yeah, I understand, thank you. Or if not, then you need to, if you still have time, in history taking, usually you can finish within 6 minutes. Okay, so you must remember, you need to go slowly. Okay, go slowly and ask. 8 minutes, a lot of time. You will have around 1 minute left behind if you go normal rhythm, but you can, if you still have time, you need to ask the patient, do you have any further question? Do you want me to explain you again? She say yes. Okay, then you have to go for the further explanation. Okay, according to Miss for example, Miss Lena, you have presented with this complaint. Okay, this, you're non-alcoholic or you drink social drink. Okay, I collected data from you. It looks like you have this problem. What I'm going to do, I'm going to keep you in observation room. I will do the examination of your tummy, or I will examine your tummy, and then I will do some blood tests, which will include this as blah blah, and also I will do your tummy scan. So this is how you will explain. Means repeat means summarize. Summarize the complaints and also the management plan to the patient. Excuse me. Could you please, excuse me. Could you please mute your mic? Thank you. So then you need to summarize the management plan, also the patient complaints, and then you have to, this till while you are doing so, your time will be up. Once the bell is ring, you need to go out from the room and go for next station. Okay, is it clear so far, guys? Is it okay? I will put this slide in the group as well for you. Okay, so now the approach about the patient present complaint in station with the pain. So this is approach. So you need to presenting complaint, you need to get through this way. Okay, so Socrates as his represent here site, you need to ask the patient, can you please localize your pain? where is the pain located? Can you please tell me where do you feel pain? Or can you please localize your pain? So patient will say, yeah, oh, doctor, here on my right side, or doctor on my left side, she will say like that, or she or he, any patient. So, okay. The next is on-site. You need to ask the patient, could you please tell me when, excuse me, can you please mute your mic? Thank you. Okay. So the next is on-site. So you need to please make sure that you should ask this question in your own words. You don't need to follow exactly what is written here. You need to ask her, when did it start, or when did you feel the pain, or when did it start, today suddenly, and then you need to go for. She will say maybe a few hours ago, today in the morning, or yesterday morning. Then you ask her, did it start suddenly or the gradually? She will say gradually or suddenly, etc. Then you have to characteristics. Is very important. How would you describe your pain? Is it like a pressure, stabbing, sharp, tearing, etc.? Then you have to go for radiation. Is your pain go anywhere in your body, or does the pain spread elsewhere? Like this kind of question, like shoulder, back, neck, or jaw. Then she will explain, yeah, it goes to my back, or it goes to my shoulder. It depends. Associated symptoms. Oh, do you have vomiting with the pain? Okay, is your pain associated with the vomiting? Like this kind of question. Or then you have to go for type. Is the pain continuous or on and off? She will say continuous or maybe on and off. This is about the pain. Remember that I'm focusing this only for the patient who present to you with the pain, okay? You follow, you need to go for present and complain this way. The next is exacerbating factors. You need to always ask her, like, is there anything make it better? Is there anything make it worse? Okay. So you need to, maybe she will say, yeah, paracetamol, or when I take paracetamol, I feel better. Well, but after that, again, it's going, yeah, it gets worse when I'm leaning downwards, or yeah, like this. She will say, yeah. So you need to find the exacerbating factor. Severity of the pain, you need to ask, how would you rate your pain on a pain scale 1 to 10? 10 being the worst. And she says 7, 5. So you will know about that. So we are just focusing on pieces of information, because I'm not going to go for the audio part right now, because I don't want to give a lot of information that you cannot remember. Okay, that's okay. So let's come up with the station we are going to have right now. So it will be like that on the outside of the door of the station. You will have the scenario like that, and they will clearly mention the task. Your task will be mentioned here. Take a history from him and then explain a management plan. When you take the history from the patient, you will know what is. Maybe patient present to peptic ulcer disease, maybe patient present with the acute pancreatitis complaint. It depends. I have the table down. I will show you how you can better understand, okay? So you will have it. So this pie chart and the chart which I showed you in a previous table where the score is marking, these are very, very important. Nothing is important than that. These are more important that if you don't understand your task, if you don't understand this chart, I'm sure you will not get your score. If they give you here the differential diagnosis and you don't mention that, you will lose your score. So you need to first, very, very careful to look at the chart. What is your task first? Then look at the chart. If chart is divided in 2 parts, then you must finish this information. Don't need to skip anything. So for example, here the information gathering means check history. You will take all the history and go for the management plan. For example, if, remember that history you should take nicely. If you don't know if you didn't reach the diagnosis very well, for example, patient came to peptic ulcer disease, but you diagnose as acute pancreatitis, then you are going to make a big mistake with clinical reasoning, because you will give management plan of acute pancreatitis, not the peptic ulcer disease. So you will lose your 35%. Did you get my point? So you need to be very careful. You need to collect the information correctly, and then you can give the management explain correctly. Otherwise, because they both are interconnected, if you didn't collect information correctly, then you will lose, of course, your score. Another, I say, differential diagnosis, maybe they can change it here, something in, or that they can aid it. So you should be ready for any changes or anything. So I'm talking about the history taking. Let's little bit the same, let's use the same slide, but if there is a resuscitation, you see the most of the course provider or providing resuscitation station, we will discuss in resuscitation in detail, but just I want to give you idea that you can see that the people say you need to assess and management. Task is assess and management. But what is happening, new modification, the Mrcem is doing now new thing that they give you in the chart here, for example, assess and in management. And here they maybe give you the preparation. Now what's happening that you need to prepare by yourself. For example, you go into the station. For example, there is a patient with the vomit blood, for example, okay, and the patient and you have resuscitation. You found that assess. Your task is prepare the equipment and assess and manage the patient. So this is your task. It means 3 points: preparation, assess, and manage. So you get into the station, you introduce yourself, and then you ask a nurse, "Are you ALS certified, etc.?" And she yes. And then you ask her, "Are you happy to manage airway or what else? Are you okay to manage airway? We need one nurse to manage airway. Are you happy? Are you okay with that? Are you experienced about that?" "Yeah, I am." "Okay, please prepare all the equipment for that." Then she will ask you the question, "Doctor, what equipment do I need to prepare?" You need to verbalize. Okay, you need to verbalize whenever you start ALS station. Better to verbalize. Please prepare following suction. Please prepare the airway management equipment like back wall mask, non-rebreather mask. You need to say, okay, because if you do not, if for example you just memorize and when you come in the station and you do not, you just shocked when the nurse asks you, "Could you please tell me what need to prepare?" And then you don't know what to say. You will lose your 20 to 30% here because you didn't tell what to prepare. Okay, so that's what I say. So you must need to understand the task. We need to mention the preparation equipment. You need to go for that. Okay. The similarly is there was a procedure skill station. They asked the manager airway. This is recent station I from my one trust. One guy gave in. He told me they asked him to do it by yourself. He picked up all the equipment by himself, and he said he did everything to show the nurse. It's a kind of teaching, but it wasn't a teaching station. Did you get my point? So you need to be ready for that. You don't need to think like everywhere you need to, like a team leader, you will order. No. Maybe nurse will ask you, "Can you please show me how to do CPR?" Then you have to show her. If you want to suction, ask the nurse, "Can you please suction the airway?" Maybe nurse say, first you need to ask her suction, "Please give me suction." You show her and she will do. Means you need to show her. Okay, first you try to, every station you need to try to show her, and then she will follow you. If your team leader, whatever, she will say, "Okay, doctor, I do it. I do it." When she said, "I want to do," you need to go away and you need to say whatever you want to say. Is it clear so far, guys? Hello?
Sir.
Okay, this is very important. Don't think like that you will be a leader, you will not perform, you will just say no. You maybe need to do these things. Where they ask you to do, you have to do. Okay? Don't need to practice like this way on the online with the candidates, like with your friend, just verbal. I know. You don't need. You should learn how to insert the oropharyngeal airway, how to measure the size. You should know how to do the supraglottic airway device, how to insert. You maybe need to do it. Not like, maybe they will not ask you to do the intubation, but these basic things which I'm telling, like nasopharyngeal airway, oropharyngeal airway, supraglottic airway, you should know how to do it. And other suturing, you should know how to do it. Okay. And also the auto cannulation, until now, I did ask, this usually come with the teaching. So some procedure, especially airway, yeah, these you have to know how to do it. Okay, now next over this one is presentation. Okay, presentation of the abdominal pain by cause. So you should very familiar with this table. If you follow this table, that's good. But if you do not follow table, so you should be aware of how to know it's acute pancreatitis. When you take the history, the acute pancreatitis patient will present following symptoms. You will say acute onset pain. You will say constant epigastric pain radiating back. He will complain like that. When you will ask, is your pain go anywhere else in your body? Yes, doctor, my pain goes sometime on my back. She will put her hand like this, and then you will come up the social history. Yeah, or you do you smoke or drink alcohol? Yeah, I drink alcohol. How many units? Okay, following units. Or do you have any past medical disease? Yeah, doctor, I had a gallstone. Oh yeah, I had before pancreatitis, same problem before. Like she will tell you like that. So you should, from history, you will understand it's acute pancreatitis. Then you will go for management plan. Then, okay, according to your data, you said that you have pain which go backward. You have also history of alcohol. You said you drink alcohol sometime. If she said more over, so and or you can, if she said she has a past medical disease of gallstone area. I see you have the gallstone before. Yeah, it could be likely the acute pancreatitis. So what I'm going to do, I'm going to keep in observation room. I'm going to do examination. I'm going to do some blood tests, which will include the lipase, amylase, these all you have to mention. Then you will say, I will involve the medical team, etc. You need to tell her, okay? So this is management plan. So patient will present likely with the following complaints. Infected obstructed kidney, the patient will present with a colicky, flank pain, sharp and severe, and with maybe with relief in between, radiating from loin to groin, she will tell you, and history of fever if complicated with infection, dysuria, previous urea, ural lithiasis, the urethral stones. So this is how she will present to you with the infected obstructed kidney. So you will also give the management plan according to is for first of all you will give the painkiller, okay, and then you will do the scan of KUB, okay, and then you will involve the or refer to her to urologist. So this is how would you see, or and also you can discharge because we have a special criteria with the patient with the kidney stones. Depends on the number, less than 5 or more than 5. So if you say if it's a 10, so you will immediately refer. It's need urgent intervention. If less, maybe you can give the conservative treatment and discharge her with the printed leaflet. It depends. Okay, so next is our mesenteric ischemia. Yeah, sudden onset patient will present. You see, here they mention acute onset, maybe few days, few times. Sudden onset, always severe. Okay, this is very, very severe. So in this, need urgent intervention. So sudden onset, she present, constant, and she's a severe. And the most important, the people will be here, more likely elderly patient. Okay, may start from peri-umbilical. I never seen anybody got this kind of station still now, but you should know what is the characteristic or clinical presentation of the mesenteric ischemia. Next is perforate viscous. Yeah, the constant short pain increase with the moment history diverticulitis peptic ulcer disease. So yeah, more likely patient will present to you this with this kind of features. Rupture ectopic, yeah, female, likely young. So you will find according to, it's already mentioned here, abdomen, localized affected sites. Okay, I'm sorry. Yeah. The last one we have the leaking abdominal aortic aneurysm. So this is elderly. First of all, the patient will be in history of cardiovascular disease, maybe patient present to you, smoking. So these all give you the feature how the patient will present to you. Okay, guys, so was the last slide, and we will start with the we just finished our introduction application and also how the system it works. Our next session, we will focus on the Socratist. Okay. So we will start with, I will put some slide in the group for the history taking, and we will start with that. I will try to make live video with the patient. I'm not sure if I get time, I will do that. And I will show you how you can enter in the room and how you will get the history from the patient. And then I will put this video in the group. I cannot promise, but I will try to record that video for you that you can better understand how to approach this everything. Is it okay for you guys? Hello?
Yes, sir.
Yes, sir. Thank you so much.
Yeah, do you have
Yes,
any
sir.
question? Do you have any question?
No.
No, if you have any question, you can ask me. It's just an introduction, and most important, yeah, modification, I just didn't focus more. I want to tell you the modification new or that, first of all, before was like this is recent. I heard from some candidates because those went from my trust, but I'm not sure this is really, it didn't mention on the website, but the new modification recently is that they say now they are going to not like before, like if you have like in the morning you have your exam, so they will count all the scores, the cutoff mark in that day or in that time. But now they are saying they are going to cut down score generally. All the people, means from, it's usually go 1 week, so it depends. So please, I just advise you every guys, I'm not sure about that, but when you go for exam, do not tell the station to other guys, okay? This is very important because I'm not sure it's correct or wrong. I cannot confirm because I don't have the official statement, but what the people said, they said when they went in the exam center, they give the briefing and they told them, so you guys are doing wrong that you are telling to people, but it's generally affect to everyone. If you tell a station to other guy, tomorrow he came up, maybe he will take over your score, means he will get more score, maybe you get less, and the closing cutoff will be high, you will maybe fail. So my advice to you, try to not tell to station to anyone. Better, it would be better. Another thing they told us, like, yeah, the next is things still now the people say, okay, you just need to verbalize, you don't need to do. No, you need to do first, okay? When the good thing is that when you come in the research station, you just go, you need to introduce and go to the patient hat, for example. You need to manage the airway. You need to, if you want to do suction, could you please, nurse A, could you please give me the suction? You should know the name of the nurse. Okay, nurse Linda, Linda, could you please give me suction? I need to suction airway. Maybe the nurse will say, okay, doctor, I do, please, you can stay, I do. Yeah, you need to say first and you need to try to do, but nurse will take over after you. That would be more and more, that means you are more professional, you know how to do. This will also give the good impression to the examiner, okay? So you need to be very careful and practice like a real doctor, not like just online, but you need to ask your brother, sister, anybody at home. You need to do the practice on them, okay? This is very important point. And next important point, I would say the chart understanding is more important than for example, people say check accuracy, safety. No, this chart is more important. You understand the task. If they mention you 3-point preparation, assess, and management, means you need to cover 3 points. You don't need to cover 2 points. You will lose your score. Did you get my point? So you need to be very careful with the chart. Okay, guys. So the next webinar, I'm going to put these all slides hopefully in the Telegram. First, I will send you the Telegram link. You should join, and I will also put this recording in the Telegram, and you can watch out whenever you need it. And some slide about the traveling, like what you have to do, and you need to write. And next important, you need to make some your own notes if you need it. Okay. Okay, guys.
Yes, okay.
That's
Yes,
okay
sir.
for you. Do you have any question?
So for history taking, is it possible for us to note it down what the patient is telling?
Could you please tell me, say it again? Pardon, I couldn't get you.
Like the history taking, can we note it down in a piece of paper what the patient is telling?
Oh no, I heard about the Malaysia diet. They told me that they had a paper and pencil, both. They hate it and they note, you can note it. But in London diet, you don't have anything. Okay?
Okay.
Okay, but regarding the slide here, if you want, I will send in the group. You can note it. But about in the exam, no, you will not have in London diet. No, in Malaysia diet, I heard it. They said yes, they had a pen and pencil and the paper. You can note it down, but I don't think so. You will have that much time because you need to look at the patient eyes. You know, you will sit very close to the patient. In London, even they didn't give us a table. Okay, but in Malaysia, the guy said there was a table in between patient and the doctor. In London, you will be very, very close to the patient.
Okay.
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 And I
Okay,
have a
guys.
question about
Yes.
the associated symptoms.
Yeah.
Do we have to, like you said, to ask it relevant to that system, right? The first question, and the remaining questions, do we have to ask all the systems? Do you have to cover all the systems, or?
Yes, you need to cover. Either it's good to ask her some relevant symptoms in Socrates, but if you don't ask, no problem, because you will go for system-wise again, right? So it's up to you. If you ask, it's okay. If you do not ask, because you will need to go for the system-wise, so you will ask these again question in that place. So it's
So
no
in
matter.
the associated symptoms, we have to cover all the systems, starting with the
Yes,
relevant system, right?
yes, you have to. You have to do that. And remember, any patient present to you pain, you need to follow the Socrates, any painless, Oedipara. I didn't put it here right now, but I will do it later on when we will come up to this station. So next webinar will be on the Socrates. Okay, guys? Thank you for joining. Come up with the next, okay? I will inform you in the group. So when we will practice as well, and I will tell you how to make it better. Okay, good luck, guys, and thank you very much for joining.
Thank you, sir.